Hello, scholars. Hope you guys are doing well. And so welcome to week 9. We have a lot to cover this week, and so let's get started. This is actually video 1 of 4. And so today we're going to have a very short mini lecture on how to write case reports. An essential characteristic of a publishable case study is its educational value. Writing case reports for journal publication is one of the best ways to get started in medical writing. And so most case reports fall into one of the following topics. 1, unexpected associations, linking a disease or a symptom with an unexpected event. Or 2, new insights into pathogenesis, discoveries that offer new understanding of disease mechanisms. Or 3, unique features, rare features of a disease or novel therapeutic approaches. And so when drafting your case report, start with the introduction. Ensure the rationale for reporting the case is clearly explained and ethically supported by the references used in your paper. In the case description, make sure the case is described adequately, briefly, and also clearly. Include results of investigations, particularly noting any less common laboratory results with their normal values. In the discussion section, present evidence that supports both the diagnosis and the recommendations. Address other plausible explanations, discuss the case's implications and relevance, and suggest directions for future investigations or management. Introduction tips. The introduction should be brief, outlining why the case is important to the reader, because remember, you're going to fill a gap in research, and why it's being reported. It should also provide a clear purpose for the case discussion, often presented in chronological order. The case discussion is typically presented in chronological order. Include details such as the patient's presenting symptoms, medical history, relevant family and social history, medications, physical exam results, lab tests, differential diagnosis, final diagnosis, treatment, and outcome. Legal and ethical considerations. When writing a case report, use anonymized identifiers like patient A rather than names or initials. Only provide relevant examination and test results. Ensure that your report adheres to legal and ethical standards. Case series versus case review. Distinguish between a case series and a case review. A case series involves cases drawn from the author's own experience or institution, while a case review includes cases from published reports or literature. Patient confidentiality is crucial. Conceal the patient's identity and secure informed consent when privacy is at risk. If there's any doubt, the patient or their family should review the manuscript, and a copy of the informed consent should be included with the submission. And so that is it for today, scholars. Well, there's actually other videos to view, but in regards to this specific mini lecture, that is it. Thank you for listening. And I'll see you for the next video, video 2 of 4. And as always, you've got this. Keep up the excellent work. Thank you.